alignment specialist with the sciatica symptoms exercises for you as promised. So sciatica, very common, but we have to realise that it is a symptom of something. It's called, the sciatic symptoms are being caused by something else. And what I do in my profession is not look at the symptoms at all, we look at the cause. Because there's always a cause. You need to ask why these symptoms are coming up, why the sciatic nerve is being irritated. And we look at the whole body as a complete structure. And generally with a lot of people that we see with these sciatic symptoms that come to us, the spine has lost its normal position and the hip and the pelvic girdle has also lost its position. So the 4 exercises that we're going to do are tried and tested, and they are designed to put these 2 really important areas of the body back where they belong. Okay, so before we start, you're going to need a cushion. That's all you're going to need. Okay, the video and the exercises as well, they're not here to give you medical advice. And of course, if you think there's something a bit more to what you're feeling, an underlying problem, then obviously you need to seek a medical professional for help and advice. Also, if these exercises don't have the desired effect, and like I say, they are tried and tested, then you may have something called piriformis syndrome, which has the same symptoms as sciatica, but is completely different. Now, the piriformis, and I've got a diagram here to show you. So this is the back of the pelvis. Look. Okay, if you can all see that. And the piriformis is number 1. So it attaches to your sacrum, that bottom part of the spine there, that big bony bit at the bottom, and that's your SI joint, sacroiliac joint. And it attaches to the femur, so the top of the thigh bone there, okay? That's your piriformis. Now, say for instance, if you've been taking the winter off gardening, there's not much to do, and you go back into the garden, you're bending up and down, picking up the weeds and what have you, then the muscle that lies on top of that is your big gluteus maximus muscle. So the muscle that we can all see and feel on the top here. So you can imagine every time you're bending down to do some weeding or some digging or what have you, or you're putting pressure on one side of the body and not on the other, and that piriformis can start to get overworked. If the piriformis starts to get overworked, because the sciatic nerve travels through it, then the sciatic nerve starts to get irritated. So it's a different way round than sciatica. With sciatica, it's the nerve that's the issue, or the positioning of the body that's causing the nerve to be the issue. But with the piriformis syndrome, it's the muscle that's irritating the sciatic nerve, and it's dealt with in a completely different way. So let's see how we got on with these sciatic exercises and see how we do. The other thing that we need to make sure of with these exercises is form. It's really crucial that you follow the instruction to the T. The instructions and the positioning of the body is there for a particular reason. Okay, so pay attention to the exercise. What I would suggest that you do is do one of the exercises, pause or listen to one of the exercises, pause the video, do the exercise, and then go on to the next one until you get used to it. Okay? With the 4 exercises, what I want you to do is repeat them from start to finish 3-4 times, okay, depending on what your symptoms are like. And they can be done twice a day if you want to, but if you can do them daily, it's the repetitive nature of these that makes them work, okay? And by all means, let me know how you get on, good or bad. And of course, if you have any questions or you're not sure of exactly what you're doing, because I want you to be confident that you're 100% sure in the instruction that I'm going to give you, that you are doing it correctly. If you have the least bit doubt, please contact me because I want these to work. I want to get you off the painkillers, and I want to get you walking around without any discomfort, because it is really not necessary, and it pains me that people are doing this when there are other alternatives out there. Okay, so that is what we're aiming for today. So the more you can do these, the better, but be aware it's the instruction and the positioning of the body that really counts, that really makes the difference. Okay, so here we go with exercise 1. Now, going down, we don't need the cushion for this one, we're going down into a bent leg position, and your feet are hip distance apart and your toes are facing forward. Now, this may feel a little bit pigeon-toed to some of you, but your second toe in should be pointing forwards, not your big toe, the second toe in. It's a little bit like we did the heel raises on the foot video that I did. So you can see from there, that's my second toes in pointing forwards. Okay, so we're not here. Please don't do this like this. Okay, we're here. All right. So into lying position, feet underneath the hips, hip distance apart, toes facing forwards. Okay. So all we're going to do here is squeeze your bum muscles. And that's it. Okay. Now, you can put your hands here with the palms up, it's up to you, or you can just put your hands just onto the side of the legs here, and you can actually physically feel what those muscles are doing. Okay, so all you're going to do is squeeze and slowly release. Squeeze and slowly release. I'll take my hands away now so maybe you can see. Squeeze and slowly release. Squeeze and slowly release. What we're not going to do is squeeze, release. Okay? All jerking and pelvis moving and stomach pulling in, and that's not how this is going to be done. Okay? We need to control the squeeze and we need to control the release. We need to control the squeeze and we need to control the release. Okay, really work on making this nice and smooth, nice and controlled, keeping the feet flat on the floor, not tilting the pelvis. So if when you're squeezing in you feel that happen, that's your stomach muscles starting before those gluteus maximus and the bum muscles that we're trying to work, okay? So nice and slowly squeeze and release, squeeze and release, okay? Nothing more than that. That's your first exercise. You're going to do 20, and this is the starting exercise when you do the repeat. Okay? So nice and gently squeeze, release, squeeze, release. No pelvic floor movements going on. Forget about that if you've ever been taught about pelvic floor. We don't want your tummy muscles pulling in. We don't want your legs moving. We don't want your feet coming off the floor. It is really purely exercising these muscles here in a controlled way. Okay? That is exercise number 1. Okay, so you can pause me here if you want to do that exercise now. Okay, and then we're going to go on to exercise 2, and this is where you need your cushion. Okay, we're staying in the same position. Now, you want something that's about 6 inches in width to give you a decent pad to push against, and you want something that's quite firm. Okay, so if it's going to give, it's just a little poxy little cushion, then it's not going to be enough. Okay, so you want something, because you're going to press the knees against this. Okay, so the cushion goes in between the knees. Again, you want your feet hip distance apart with those second toes in facing forwards. And down we go again. Alright, so that's your starting position. Again, you don't need your hands here for this one, so they can be out to the side and always with the palms facing up to the ceiling. So without going any wider than the hips, you're going to squeeze that cushion just by bringing the knees in together, and you're going to aim for about 50 or 60% squeeze. So it's gently squeeze and then slowly release. Gently squeeze and then slowly release. Okay, just go watch your tummy muscles on this one because we don't want them pulling in. There's too much emphasis on core and tummy muscles pulling in. You don't need to be zipped up or whatever it is you've been taught in maybe other lessons. These aren't fitness exercises, these are postural alignment therapy exercises. So nice and gently, squeeze and slowly release. Squeeze and slowly release. The feet are flat on the floor. All you're doing is bringing the knees in together, slowly push and then slowly release. Everything is nice and gentle. Okay? The last thing we want to do with muscles that are probably very tight in this area is tighten them even more by going too quickly or too sharply. So, all this happening, squeeze, release, let's get it over and done with, that's not going to work, it's not going to happen. And also when you do something a little bit sharply, you'll find that if you do this quickly, your bum muscles kick in. We want to isolate now the insides of the legs because they're the ones that are just squeezing that cushion gently. Then you'll find that the rest of the pelvis and the rest of the muscles don't start to come in beforehand, which is not what we want. Okay? So you're going to do 20 of these. Alright, that's your second exercise. Now if you want to pause me, please do it now, because we're going to go on to the third. Okay, the third exercise you don't need a cushion for. Back down in this position, okay? So you find with all these exercises they're very gentle but very effective. And all you're going to do now, same position with the knees and the feet. You're going to very slowly cross one ankle over the knee. You need to make sure that this leg stays where it is rather than having the leg come into the centre or even externally out of the body, so your hips are flat on the floor. And just using your leg muscles, you're going to very gently push this knee away from you. Okay, so nice and gently. There may not be much movement that comes initially from this exercise, but you're going to time yourself and do 30 seconds. Okay, so you start off nice and gently. Again, I'm going to come back. If you do this immediately, everything's going to go tight again, and we don't want to do that. So start off nice and easy, just gently push that knee away from you. Keep this leg in this upright position with the foot flat on the floor. Okay, 30 seconds in this position. No other tension anywhere else in the body. And relieve the tension, replace the foot back down, again underneath the hip, toes facing forwards, and then change legs. And then again 30 seconds, start off evenly on this side. Nice gentle push back. We're only using your leg muscles to push that knee away from you. And then release. And then put the foot back down onto the floor. Okay, that is exercise 3 if you want to pause it now. Okay, we're now going to on the final exercise in the first set, and don't forget 3 or 4 sets would be brilliant. Okay, so for this one, still staying in the same position, however, this time the soles of the feet are going to go together and you're just going to let the knees just drop out to the side. Okay, just let the legs relax. Try not to keep any tension in the legs, because in initial cases with this one, you might find it's a little bit comfortable, uncomfortable on the inside thigh, but don't worry about that. If it does get uncomfortable or the legs start shaking, then just bring the knees back in, just hold it for a second or two, and then take the legs back out, and then reposition soles of the feet together, just let the knees drop, and let the legs relax. Okay, try not to hold any tension by squeezing your bum cheeks and stuff. Make sure the whole of that, the pelvic girdle and the lower back are nice and relaxed. Don't try and push the back into the floor, because the back, your pelvis has now changed position, so just let it happen. Okay, so you're going to time yourself with this one, and this is going to be a minute. And again, if you've done sort of like 20-30 seconds and it gets uncomfortable, bring the legs back in. Okay, give yourselves a few seconds, take the legs back out again, and again just let the tension go out of the legs. Okay. Throughout this I want you to breathe. Please don't hold your breath. Make sure that you are taking some nice deep breaths. If you can, use your diaphragm, that's the best way to do it. And again, the arms are out by your sides with the palms facing up. Okay, so 1 minute in this position, and bring the knees back in, and that is exercise 4. Okay, so repeat all those 3 or 4 times. I'll put some comments from people on the top of the posting, because they are tried and tested and they do work. Okay, but please, honestly, let me know if there's anything that you're not sure of. Then please do ask. Okay, because I would like you to do this properly so that you get some really, really good results. Okay. 2 final things. One is this stuff. Because we're repositioning things here, and because the muscles, you're going to want them to work nicely for you, the more you can drink of this, this is your muscles friend, the better it gets. Okay, so make sure you up your water intake. That will help you big time. And second is, if you're doing any exercise that maybe you're going out with the dog, you're walking and stuff, always come back and stretch afterwards. Really important and crucial for the whole area around here. If you do some stretches, I'll put some on the Facebook page underneath or very close, so that you can keep an eye on them or print them out or do whatever you want them. But if we're loosening up and repositioning here, if you are walking and are exercising, then stretching afterwards is really going to help. Okay, good luck. Thanks ever so much.